UVA has joined a new initiative aimed at bringing researchers together to work toward treatments for conditions and diseases affecting patients across the globe. Kendall Hansen has a look at Spark Global and how the partnership could further innovations beyond grounds.
Getting medicines out of the lab and into patients' hands is what the Spark Global initiative is all about. Now, UVA wants to help make those connections.
Really about speed, focus, and impact, because ultimately patients are waiting.
The Spark Global initiative brings more than 40 institutions together with academic expertise and industry. Mark Esser heads UVA's Paul and Diane Manning Institute of Biotechnology. He says Spark Global will move research forward for patients at UVA and beyond.
Ultimately, not all molecules can become a medicine. It takes a lot of hard work to transform science into a medicine.
Transformation through collaboration, working across disciplines to bring research on cancer, infectious disease, autoimmune conditions, and more to those who need it.
Having access to these resources, most importantly, the know-how and expertise, will help move that promising science to patients faster than ever.
Kendall Hansen, 29 News.